Hello, my name is Ganatra, consultant medical oncology and bone marrow transplant at Surya Hospital. So today our live session is regarding information and destroying the misinformation. We want to give you information as well as the same time we want to break the myths around the cancer. So first of all, let's understand what is cancer. If I put in the simple word, cancer is the uncontrolled growth of cells which are immature and which are not functional. So, like if any organ in a body, the cell growth, cell replication, cell division is very controlled. So, for some example, our skin cell, we all know that they are changing every 21 days. So they are not produce more, they are not produce less. So there is normal skin. But if there is a skin cut, so our body will say, okay, now we have to produce the skin cells more rapidly. So they will produce in like 5 days or 7 days. So the growth is accelerated. But when the skin is formed, the skin growth again goes to the normal cycle. So this cell growth is well controlled. But what if there are some mutations that are occurring in the control mechanism? So that will lead us uncontrolled cell growth. And this cell growth are not very matured. Before they get matured, they start going for the division. So they are immature cells. The cell growth is uncontrolled and they are very loosely held together. So they spread around. So this is in a way it's all cancer. If we talk about the how big of a problem of a cancer in India, so unfortunately I have to say that last year, according to the Government of India data, there were 14.5 lakhs new cancer cases in 1 year. So if I want to put in the perspective, if we take the India's population like 140 crores, so that roughly means that every one out of 825 patient people in India got cancer. So this is a quite high number. Uh, but if you diagnose a cancer at a timely manner, early, so the treatment is possible. There can be cure with the current advances in the medical field. The treatment is possible even for stage one widely spread cancer as well. So the thing is that there are a lot of misinformation available in on internet. So our patient asks us very often that, sir, is this true? Is this true? So the most common question that I've been asked that, sir, can we eat sugar? Can a cancer patient eat sugar? Because people are saying that the sugar is bad for the cancer patient. If you eat sugar, there will be cancer. If a cancer patient eats sugar, so the treatment will not be successful. The chance of cancer coming back is fine, so we stop eating sugar. So there is completely myth. There is no, there have been extensively studied about this. There is no correlation between sugar and the cancer. Sugar is essential for each and every cells of our body, and this doesn't give actually cancer. Those who are eating sugar, those who are not eating sugar, there is no difference in the response of the chemotherapy, and there is no response of there is no difference in the chance of cancer coming back. If the cancer is caused by sugar, then each and every one of us will get sugar because we are taking sugar some or the other form. Okay, so a cancer patient can eat sugar whatever they want. If there are dietary restriction because of diabetes or something, that's a different thing. But for cancer point of view, there is no restriction for sugar eating. Now people are going for the artificial sweetener. So currently there are news coming up about the artificial sweetener, particularly aspartame that you can find on the diet coke. So a lot of patients are asking me, is taking diet coke, is taking aspartame safe? So there are a lot of studies on aspartame, artificial sweetener, which is the most common one. So WHO, World Health Organization, and another international body which is called International Agency on Research on Cancer, they both have studied all the data available about aspartame, and they have concluded that it might be causing cancer in human. Now we are using the word might be because we cannot do the human experiment that we give 100 people sugar and 100 people aspartame and who is having more cancer. But there have been animal studies, there have been surveys, and they have found that there could be a link between aspartame and cancer. So yes, they are going to publish that statement in the mid of the July, and I would take this very seriously. There have been argument that you need a quite lot dose about to get a cancer with aspartame. Right. So whatever the literature is mentioning that you should take, there somebody has to take 40 mg per kilogram of body weight in a day of aspartame to get a cancer. But that doesn't tell you anything that less than that is safe. Like if we know that smoking cigarette is harmful, so somebody might be saying that if I take one cigarette in a day, will I not have cancer? No. If you, even if you're taking one cigarette, you still get cancer. So I don't think that we should be defining any safe doses for aspartame. You should avoid aspartame as far as possible. And if you want to go for artificial, no, if I say that's sugar alternative, so I would suggest stevia. Stevia is a natural leaf of the plant, so which is not having any chemicals, which has got similar taste of sugar. So you can use stevia. Now, let's look at some comments on the chat box. Mrs. Kalpana Mistry is asking that is there any effect? Yes, there are chemotherapy side effects. There can be some side effects which are inevitable, and some side effect which can be managed, and some side effect can be preventable. So one thing is that with the most of the chemotherapy, there will be hair loss, but hair loss will not be permanent. The hair will come back uh, depending on the different of patient, but it will come back. So it's not a permanent side effect. There can be decrease in the WBC, but we can also give WBC booster injection, so the WBC doesn't decrease. And if WBC doesn't decrease, there is no higher risk of infection. There can be nausea, there can be vomiting, there can be change in taste of the mouth. So we can give medicine for that so that the patient doesn't have vomiting. They eat normally and they maintain their health. Previously, the chemotherapy protocols were not so finely defined. There were no target therapy available. There were no immunotherapy available. So the chemotherapy used to be little bit harsh. So at that time, the side effects were too much. Previously, the WBC booster injection were not available. So patient would get the low WBC count. They will fall ill. They will fall sick and very bad infection. But in these days, we have lots of medicine to prevent the side effect, and we have lots of improvement in the chemotherapy protocols. So most of the patient, even the very senior citizens like 70, 75 plus patient also can take chemotherapy without any much side effect. There could be some, but they all are manageable. That Gopi Singh is asking that cancer, how does cancer start? So what happens that one cell can get a mutation. The beginning, I said that our cell growth, cell division is very, very strictly regulated. So the regulation gene, if they are mutated, they will send the signals of mutation division uncontrollably. So cancer starts with a single cell which divides very rapidly, and before they get to the mature cell level, they start dividing again. So the growth is very fast, and it will hamper the functioning of the normal cells nearby. So initially there will not be any symptoms, but then there will be the organ, whichever organ is there, which will have some effect on that. Like if somebody is having kidney cancer, so the kidney will the urine will have blood. If there is a blood cancer, so blood cancer starts in the bone marrow. Bone marrow produces normal RBC, WBC platelet. So the hemoglobin will go down, the platelet will go down, there will be some bleeding. So the cancer will give indirect symptoms. Sometimes there are direct symptoms as well. So like if there is a brain tumor, there is a mass in the brain. So it will give headache, there will be fits, there are some direct side effects like if there's a prostate cancer, the prostate will enlarge, the urine flow will hamper, so there will be problem in the urination. Okay, so cancer starts, but the effect can be seen little later. So this is where the cancer screening comes into place. In foreign, in a Western country, they require cancer screening like mammography, the PSA test, and all this kind of screening test for the insurance renewal. In India, we are not very strict about the cancer screening test. So patient will not have any symptoms in the beginning of cancer when the cancer is stage 1 or stage 2, but when it is spreading, it is a substantial site, then they will have symptoms and then they go to doctor. If they go to doctor early, the treatment will be easy, the success chance is much high. So for example, if I give you example of lung cancer, so in lung cancer, our lungs are very big. If there is a tumor of 3 centimeter, 4 centimeter, 5 centimeter, there will not be much symptoms. The patient will be fine. There will be some occasional coughing, but there will be no decrease in the oxygen or some breathing problem. It will start when the tumor is such a big. So most of the patient in India, they even if they are smoker, they are not doing the X-ray screening regularly. When somebody develops cancer, which is already spread out, but in the COVID time, so many people were doing CT scan because of query COVID symptoms. So at that time, we have seen so many lung cancer, which were of stage 1, stage 2. So they were managed easily. They all are cured right now. They are doing fine without any treatment. Treatment is completed and they are not. The tumor has not come back. So they are cured. So this is the benefit of screening. When the cancer starts, it will never give symptoms, but we can catch it early with some test. But when the cancer spreads sometimes, and then there will be symptoms, and then it's a problem. Now, Jayu Rao is asking that can cancer surgery or tumor biopsy cause cancer to spread in the body? Yes, that's a very good question. Almost everybody has this myth in the mind that if you do the biopsy, the cancer will spread. The biopsy will not let the cancer spread. The cancer cells are itself having a characteristic that they want to spread. They will get into the blood vessel, they will get into the lymphatic vessels, and then they will start sending the seeds very early on. So the cancer surgery or tumor biopsy, there is no chance that the cancer will spread because we are not, putting it anywhere else. We are just taking it out. So it is coming to the out in the container of the biopsy, and it will not go anywhere else in the body. Even without tumor biopsy, the patient comes with the spread of disease. So they didn't have any biopsy. The cancer already spread. So that it is a nature of the cancer that it spreads. It does not have any connection with the biopsy or the surgery. Now, other myth people are having is that the cancer is communicable. If we live with a cancer patient, we might get cancer. Or in other words, people are saying that if one person in the family is having cancer, the other people will have cancer. That is not right. Cancer is not communicable disease. It's not like that if I touch a cancer patient, I will have that cells and I will have cancer. No, it's not like that. Cancer doesn't spread a person to the second person. And there are a few cancers which has got genetic basis, but they are very less number, less than 5 to 10% of cancer patients are having any genetic basis. They are like breast cancer, ovary cancer, some bone tumors. Those patients should test for the cancer genes. If they are positive, we can test the cancer genes like BRCA1, BRCA2 genes, RB genes to the family members, and we can see that if the family members are at higher risk of getting cancer. Having said that, everybody has to look into their family. That if there are any red flags about cancer, so they should check themselves for the cancer genes. So what are the red flags? If there are too many cancer patients in the family, then this family might be having some cancer genes in the family, which is being transmitted, and there can be having higher number of cancer. If the cancer is usual, but the coming at the unusual age, like somebody is getting breast cancer at 25 years of age, somebody is having colon cancer at 20, 25 years of age. So there could be the chances. The usual cancer, but the age is unusual, very early on. Then we can suspect that there is some genetic causes for the cancer, or if there are some unusual cancers. So if somebody is having this kind of red flags in the family, there could be the chance that the family might be having some cancer genes. Okay. Now, somebody is asking that please let us know about targeted chemotherapy. So it is targeted therapy and immunotherapy. I will tell you in the very easy manner. So early on the our talk, I said that there will be mutations. They will be sending the signals that you should the cells should divide more, and before the cell gets matured, they have to divide further. So there could be some mutation. So right now, if somebody is having cancer, if you take a biopsy and if we send it to the genetic lab, so the genetic lab can tell us that is there any mutation in the cancer cells or not. So if they find any mutation, we can see that is there any targeted treatment against this mutation. So what do I mean by the targeted treatment? So they will break the chain of the message that the faulty gene is sending. So suppose if there's a company, a CEO has gone mad, he's sending his secretary the message that you do this, and the company is getting destroyed. What if we cut the line between the CEO and the secretary? So the bad mutation will be there, but the message for the cell division will not pass on. This is called target therapy. Another thing is which is called immunotherapy, which is also coming up very recently, which has shown immensely good result. It has shown the treatment result of a previously untreatable cancer like renal cell carcinoma, hepatocellular carcinoma. They've got immensely good results. So what is immunotherapy? So our immune system is very strong. It can destroy anything. Okay, so if there's a virus coming in your body, if there's fungus coming in your body, if there's bacteria coming in your body, they will destroy, but they will not destroy the cancer cells. Why? Because for the immune system, the cancer cell is still the person's own cells. They are not the outside cells, so they don't kill it. Immunotherapy uses the immune system to kill the cancer cells by the way that immunotherapy will go and stick on the cancer cells. So they will tag the cancer cells, and now the immune therapy with immune system will attack on the all the cells which are tagged by the immunotherapy molecules. So this is the way that we let our immune system to know that this cell is not right. Please kill it. So immune therapy, the molecule will stick on the cancer cells, and the immune system will destroy that cells. So this is target therapy. This is immunotherapy, and of course there's a chemotherapy. So in anybody is having any disease, so we look at what is the latest research. Nowadays, we are doing chemotherapy plus target therapy and immunotherapy, which has got super results without very much of a toxicity, and that's why our patients are getting cured with less number of side effects. Okay. Now, Supriya Talwarji is asking diet to avoid cancer. That's a very good question. So, diet is an important factor. We should take as natural diet as possible. We should avoid processed food. We should avoid the processed meat, processed other food like cheese and everything. We should avoid the junk food. The more we have vitamins, more we have antioxidants, more we have fibers, our body cells will not get much of problem. So we should avoid junk food. We should avoid processed food. We should avoid processed meat. We should avoid smoked meat, which is common in outside, out of India. So that is something we should avoid, and we should do more physical activity. We should take fruits. We should take vegetables. We should take fibers, and we should take antioxidants. Now, somebody is asking that cell phone, the phone, our cell phone, the Wi-Fi, they all are using the radio frequency waves to communicate. And radio frequency wave has a word radiation. So that there was a fear that the cell phone can cause cancer. So let me tell you that there are two kind of radiation or radio frequency waves. So radio frequency waves, we call it another way is radiation. One is ionizing and one is non-ionizing. The ionizing radiation radio frequency wave. They go into the cells, they create the free radicals, and that causes damage. So the gamma rays and every other ionizing radiation, which causes cancer. But cell phone, the Wi-Fi signals, 5G signals, they all are non-ionizing radiation. Uh, they never cause cancer, and it has been proven time and often with a lot of animal studies that the cell phone, Wi-Fi, 5G signals are not causing cancers. But yes, there are some ionizing radiation which comes from the radioactive materials. Yes, they cause cancer. We have seen so many cancers after the Hiroshima and Nagasaki nuclear explosion, Chernobyl nuclear explosion. If the radioactive material is not handled properly, so there can be increased chance of the cancer. So if you think that the radium, so whatever the glowing material we have in our watch is not actually radium, it is something other than that. But initially the radium were used to make watches very glowy. So those it was before 1950. So those people who have used watches with the radiation, they got cancer. But the cell phones, 5G, Wi-Fi, they are not causing any cancer. Mr. Ankit Agarwalji is asking that, are there any herbal product that can cure cancer? Okay, so the answer is a little tricky. Okay, so what happens that herbal product, they claim to cure cancer, but they have not proven to cure cancer. There's a difference between claim and the proven. If I say that this immunotherapy, this target therapy, this chemotherapy, this surgery, this radiation cures the cancer, so on that sentence, I will be having some international studies. There have been this product, this radiation, this medicine has been tried on 10,000 patients, and out of them, this many have been cured. But there are no proven studies on the herbal product. Herbal product like wheatgrass juice, aloe vera, they can provide antioxidants. They can give some good things in the body. They can help you fight the side effect of the cancer chemotherapy. So you can use some herbal products while you are taking the chemotherapy. But the herbal products are not alternative of a cancer treatment because there are no proven studies. People are claiming, but there is no proof for that. Mr. Mithara ji has asked that if someone in my family has cancer, am I likely to get cancer? So we have just talked about it. I will repeat it briefly. That not all cancers are having genetic causes. There are a few genes like BRCA1, BRCA2, RET, uh, then RB gene. They all are causing cancer, but these genes transmitted in the family causing cancer are very less than 5%. But if somebody is having too many cancer cases in the family, like three or more cases in the family, they are of similar type of cancer, then there is a chance that the family is having some oncogene going on the passing in the family. If there are some cancers which occur at unusual early age, then there's a chance that there can be some gene which causing cancer. So if there are some red flags, then you can go for the genetic testing and you can find that is there any risk of cancer or not. Now, Dr. Mitha Das ji has asked that does well use increase any we have just recently talked about it that mobile waves they are not ionizing radiation. They will not cause any problem as per the cancer. But yes, screen time and in this mobile use, they have other side effects. They decrease your productivity. They decrease the social interaction. They decrease the playtime, which is very necessary for the children. But this will not transmit into cancer. Yes. Kalpana ji is asking that are chemicals and pollutant causing cancer? Yes, exactly. The answer is strongly yes. Why? Because it is our observation that most of our patient, more 75 to 80% of the cancer patients are coming from the urban industrialized area, and 20% of patients are having coming from the rural area where there is no pollution, no chemicals. So what is the difference? In cities, we are having pollution. In cities, we are eating so many chemicals in a day. So if I give you some example, like if somebody in the village, it is a hot afternoon, they want to drink something, they will drink chas or lassi. In cities, we don't have chas and lassi readily available for with us. We will drink cold drinks. So there are chemicals, there are colors, there are preservatives. If we are drinking chas and lassi, they come in the tetra pack or in some other forms. So they have to put preservatives in it. Uh, if you think about your 24 hours, you can see that how many chemicals and pesticides and the preservatives and coloring agent we are having. Approximately like taking taking breath in the Mumbai or Delhi air is equal to like 2 or 3 cigarettes in a day. It's that kind of a pollution. So yes, the cancer incidence are high in urban area, and that is only and only because of the chemicals and the pollutants. But which chemicals, which pollutants, we don't know exactly. Time and often we find that this chemical is causing the cancer. Like we talked that aspartame, the artificial sweetener in the diet coke. So if we are finding in that, then we will do about it. We ban the chemical or we give the a warning that eating this will be injurious to your health or something like that. But we don't know how many chemicals are we are eating, which chemicals having side effects. And these chemicals and pollutants are not increasing cancer; they are increasing cancer as well as the other disease like the BP, diabetes, the early age Alzheimer's. They are doing so many kind of things. So yes, we should limit the preservatives and chemicals in our diet. We should, be away from the pollution as much as possible because this is very important. Okay, so this was a very nice session. If you have any other question, I would request you. This Facebook Live will be still on the Surya Hospital Facebook page, so you can add the question. I'll be answering all the questions in the future. If you are having any questions in the comment box, thank you everybody. Have a nice day. Be healthy. Stay safe.